Okay, we're live. We're live.
All right. Welcome to our Mentor Spotlight, a live conversation to explore the role of mentorship in developing the professional identity of physicians. I'm your host, Marielle Bugayong, and I'm so excited to introduce Dr. Lyndsay Hoy. Dr. Hoy is an anesthesiologist and clinical assistant professor in the Department of Anesthesiology and Critical Care at the University of Pennsylvania's Perelman School of Medicine in Philadelphia, where she completed her anesthesia residency. During her training, Dr. Hoy discovered she had a progressive, life-threatening, and at present incurable lung disease called lymphangioliomyomatosis, LAM, which laid the groundwork for her passion in physician wellness via the medical humanities. Dr. Hoy is a member of the Penn Faculty Wellness Committee, an ardent LAM patient advocate with the LAM Foundation, and most recently, a faculty co-director of the RX Museum, a year-long online art and medicine initiative among Penn Medicine, the University of Pennsylvania, and Philadelphia Art Institutions. When she's not dabbling in the medical humanities, Dr. Hoy enjoys spending time with her new pandemic puppy, Georgia, and aspiring to cook like her kitchen idol, Ina Garten. Welcome, Lyndsay.
Thank you,
So,
Molly.
yeah, thank you. It's great to have you here.
Great to be here. And thanks also to Dr. Jeff Milstein for connecting us.
All right, so to start off, tell us a bit more about yourself. What inspired you to pursue a career in medicine?
Well, I am a clinician. I'm also a rare disease patient. I am a rare disease patient advocate, and I'm a wellness champion. I think that all of those experiences have melded together for me in a really interesting way, particularly amid the events of this year. And it's a continuing, evolving narrative for me as I continue to form my personal and professional identity. My initial exposure to medicine was through my father. And as I've watched other videos with clinicians that you've interviewed, I think it's really lovely that people are initially really inspired to go into medicine by way of our role models, our parents. My father is a retired cardiac surgeon, and I remember growing up watching him leave at 2 o'clock in the morning to go procure a heart for a transplant, and sometimes not coming back for another 36 to 48 hours later. He always encouraged me to follow my own path and not to go into medicine simply because he was in medicine. However, I was really impacted by a couple of very formative experiences at a young age. Notably, Thanksgiving of 1995, I was 10 years old, and a very traumatic personal experience happened to my family. My grandfather was found cyanotic and not breathing in the living room after we had all had the holiday dinner together. My father jumped into this completely different role that I had never seen him in. He was no longer the father that I knew. He was now acting as a very capable surgeon in a moment of personal crisis. And without going into too much detail, he performed an emergent crike on the living room floor and was able to delineate tasks and maintain composure while my grandmother looked on. My mother was there, I was there. We had to call my neighbor, who was a radiologist, to come and help us. It was extremely traumatizing, but also impactful because he was very much in control. And even though we unfortunately lost my grandfather, I remember feeling like it would be very valuable to have that skill set to act in a moment of crisis in the future. And so that was an indelible moment for me and really stayed with me as a pivotal moment when I started to think, as I got older, what I wanted to do in life. And also his ability to maintain humility throughout his career. He once took me to get ice cream at one of our ice cream parlors in the small town that I grew up in. It was not an uncommon experience for many people to approach my family out in public. Not only are we visible minorities in a small Midwestern town, so very easily identifiable, but he had operated on a lot of people in our small town, either themselves or their spouses or family members. And the woman who owned the ice cream parlor that we were at, he had operated on her husband. And he said to my dad, "What you do is so much more important than what I do." What do? I own an ice cream store. And he said, "That's not true. That's not true. We all have something to contribute to society, to the world, and that's your role, and this is my role." So I would say both of those things, very different experiences to be sure, but really formed an interesting perspective for me into kind of, I guess, the inner world of what it meant to be in medicine, to be a clinician and to care for others.
Thank you for sharing those experiences. I think I can really see how they're very indelible and very poignant in deciding how what future career you'd pursue. And transitioning to our next question, it seems like you've touched on a good number of these points already. How would you describe a good doctor? Reflecting back on how your father was, how he interacted with the community, how he treated his patients, and other physicians that you've met throughout your practice and training.
I think echoing back to that first anecdote with this extreme personal crisis, probably one of the worst situations that one could imagine being in at home with their loved ones. The ability to maintain grace under fire, or is it grace under pressure? The idea of composure amid chaos is, I think, a mark of a very good physician. It's not the only quality that's important and should be honed throughout one's career, starting from very formative years in undergraduate medical education, but I think is absolutely essential and translates into so many different contexts and situations that one will encounter as a clinician, whether it's in an acute clinical setting, in the hospital, in the operating room, whether it's with patients, if there's a misunderstanding amongst colleagues. Your ability to intentionally pause and take a step back, to gather your thoughts and to maintain personal control of what's at stake and pick actionable things to do that will hopefully help the situation at hand is, it doesn't come naturally. It really has to be exercised. And as I said, honed throughout your development as a physician.
And I think in that sense, bringing it back to yourself, how have you honed that ability to maintain grace under stress, or as you said, under fire, throughout your work as an anesthesiologist?
It's been very difficult at times because so much of who I am as a physician has been shaped by my perspective as a patient. In fact, I've never been one without the other. I was diagnosed with LAM, which for clinicians watching, I always like to give a little bit of background of what that disease is, since it is so exceedingly rare. LAM is a progressive lung disease that primarily impacts women of childbearing age. It is characterized by the abnormal and uncontrolled proliferation of smooth muscle cells in healthy lung parenchyma, ultimately rendering one with breathlessness and many respiratory symptoms. It can present with a myriad of other problems, such as recurrent pneumothoraces, or in my case, recurrent chylous effusions. Some people also have benign growths on their kidneys called angiomyolipomas or AMLs. That constellation of symptoms, in addition to imaging, usually a chest CT, is really pathognomonic for the disease. When I was diagnosed, I was 28 years old. The average age is typically 35 to 38, so I was a little bit on one end of the spectrum in that regard. I was also at the onset of my anesthesia training. So I have never been a physician in the real sense. I, of course, went through medical school not knowing I had this diagnosis, but as soon as I set off to do what I actually wanted to do, to become a clinical anesthesiologist, I was suddenly faced with a life-altering diagnosis. And having two sort of simultaneous professional and personal crises happening in a very vulnerable time was extremely challenging, to say the least. And I did not always maintain grace under fire or under pressure or under stress, because I was dealing with patients who, in my mind, were potentially showing me what my future could be on a ventilator in the intensive care unit, getting ready for a bilateral lung transplant. And it wasn't just with taking care of those with respiratory illnesses, it was also those facing imminent death, cancer patients, patients who were suffering with chronic pain. Any sort of grief was incredibly impactful and frankly very sad, and continues to impact me in those ways at times. So I really had to struggle at times to try and maintain composure, and it was not I was not always successful. There was a time in the intensive care unit when I was a resident that I was charged with caring for a patient with my disease. And that was incredibly traumatizing, not being able to really turn to many that would understand what that felt like on a very deep level. I mean, it does something to your soul and to who you are as a person, and certainly as a clinician. But I think over time, as I grew to understand how I would live with my disease and how that would shape the path that I would take, however untraditional or non-traditional that might be, I think I learned to stay calm, even in the face of great sadness that patients may bring. And they're there to receive care, and I'm there to provide it. So I really try to see myself in that role, albeit with the unique perspective of having been there myself.
And thank you so much for sharing that experience. Thank you in particular for being so vulnerable with us in this space. I personally really appreciate, hearing the story from you, hearing your journey, and hearing how, there are those rough patches in the journey. There are those moments of uncertainty, but, eventually we're able to work through it. And I'm glad that, obviously it's an ongoing process for you, but you're doing what you can. And that is incredibly important.
I think that there is a lot to be said for sharing vulnerability. And that is a theme I know other clinicians have shared with you, although from different lived experiences. And I am not the only physician who is living with a chronic illness or a potentially life-threatening illness. But I think once you are in that situation, it really does irrevocably change how you practice, how you teach, and how you decide to prioritize your life, both in a clinical setting as well as in a personal one. Learning to forge connection through vulnerability, I think, is incredibly powerful, and something that I've tried to bring into my non-clinical work with the arts and humanities.
And shortly, I'm certainly interested in learning more about that non-clinical work that you brought up. But focusing first on this note of forging connections, who are some of the people that you've been able to look up to or connect with that have helped you through this journey?
I've been incredibly blessed to have the wonderful support of a department with strong leadership who have been willing to stand by me throughout this journey. And as I said, since I was diagnosed so early on in my training, they've never really known me without this other identity of being a LAM patient. And I feel so blessed that they've embraced that and allowed me to move forward, even with that disquietude of being, what I see as other, both a physician and a patient. So I would say my chair, Dr. Lee, or my former chair rather, Dr. Lee Fleischer, who has moved on to other opportunities, was extremely formative for me in the early stages of my diagnosis and deciding to continue pursuing training. I'm happy that I was healthy enough to be able to do so first and foremost. But I was also lucky to know that people at the very top cared about what was happening to me on a very personal level. I had moments where I was extremely vulnerable, not on purpose, of course, but it just sort of would be triggered throughout the day for whatever reason if we were working together. And the kindness that was shown to me from Dr. Fleischer as well as from other people was extremely heartening. I had the great privilege of being influenced by Dr. Horace DeLisser, who is an associate professor at the Perelman School of Medicine. He was truly instrumental in kind of setting me on my path in pursuing the arts and humanities. I had reached out to him at a moment when he was implementing a wonderful program that was really harnessing the arts and humanities in a gallery workshop at the Philadelphia Museum of Art. He had done a lot to initiate that on a medical student level, but as I often say, what I've noticed is that there are so many resources and opportunities for medical students to pursue varied resources and programming for wellness, for resilience, for different interests, and that kind of tapers off as you become more ingrained in your training. And then once you become an attending, it can sometimes precipitously taper off where there are very few resources. I think that's changing a lot now, but Dr. DeLisser certainly did a lot in the beginning several years ago to instigate that in our institution. So I'm lucky to have been embraced by him and that he really set me on my path, I think, and has been a mentor from afar, so to speak. I've been able to bounce ideas off of him and get really great feedback. So those are two people that initially come to mind. There are so many others that have provided warmth and kindness, support and encouragement in different stages of my training and when I'm trying to figure out what my career is going to look like. You know, you're catching me at a really unusual moment because, like so many in this pandemic whose lives have been upended in so many ways, I am currently non-clinical because my LAM physician and I have decided that it's unacceptably high risk for an anesthesiologist with a chronic lung disease to be performing multiple repeated, potentially aerosolizing procedures on patients who may or may not have COVID. So I've had to turn to a different set of individuals to figure out what this moment looks like and what the near future will also look like. It's an evolving narrative, to be sure.
Certainly evolving indeed, but thank you again for sharing, just at least a couple of those people who have been really impactful in your journey. And as you've brought up, the warmth, the kindness, the encouragement and support that you've been able to gain from people farther along in their careers, but still willing to, lend a hand to those who are shaping their own right now. I guess this is also a good transition to something I'm particularly interested in, which is, as you brought up, your non-clinical work, your work in the medical humanities. Could you speak a bit more to that?
I would love to. I, as I mentioned, was greatly influenced by these in-person gallery workshops that were held at the Philadelphia Museum of Art with Dr. DeLisser. With his permission, I started to host my own because I wanted my anesthesia residents to be exposed to those types of community building activities that I thought were so very fruitful in terms of conversations and dialogue that arise from being in an aesthetically wonderful environment that, maybe feels foreign to many of us, being in the gallery, going to the museum. So that really set the groundwork for everything that was to come. We would often get feedback from people in the sense that they wanted to participate in those activities, but for life reasons, logistics, they couldn't dedicate 3 hours on a Saturday afternoon to come to the workshop. And so the genesis of RX Museum was really, how do we bring the museum to the hospital? And we launched this RX Museum initiative in July of 2020. It is a web-based humanities resource for clinicians, educators, and trainees, developed by a consortium of similar individuals spanning the undergraduate university at Penn, the Perelman School of Medicine, as well as the hospital system. We've been incredibly fortunate to partner with Philadelphia arts institutions, the Philadelphia Museum of Art and Barnes Foundation specifically, as well as my co-founder's gallery, the Slot Foundation, where he is executive director, Dr. Aaron Levy. So we both have worked very hard with a wonderful team of collaborators, clinicians, and art educators to bring this initiative to fruition. The pandemic has proven to be a pivotal moment for us as everything is turning virtual. And since it is a web-based virtual resource, we hope it enables our users and subscribers to engage with art in a thoughtful and hopefully engaging way as well. Our curriculum is a 52-week long course of sorts, if you will. And while that sounds daunting, it's really not. We strive very hard to make it digestible and legible to people who may not have a strong background in the arts. We've been very intentional about curating a selection of 52 pieces, since it is a year-long conversation, such that every Monday, subscribers will receive a new artwork in their inbox, accompanied by what we hope is thoughtful content and commentary, as well as essayistic reflections expounding on traditionally challenging themes, I think, for clinicians. Managing uncertainty and tolerating ambiguity, what it means to die well, or how to take care of someone who is at the end of their life, how to describe and also hopefully address social determinants of health, inequity, racism, stigma, and so many others. We have so many themes, and it's very broad, and it's intentionally broad because we want to, again, just like we do in the gallery, engage in some thoughtful conversations and dialogue, even if we're doing it from afar. So that's just my elevator pitch.
Well, it's wonderful. And I have to be honest, I did explore the RX Museum prior to this call. And for all of you watching, I'd certainly encourage you to do the same. It's really beautiful. The descriptions and the pieces that you all have selected, they really do touch on a lot of really important philosophical questions that, whether we like it or not, do impact patient care. And so I thank you so much for assembling that and for having this, as you say, 52-week course.
Thank you. It's an interesting opportunity, again, amid the moment that we find ourselves in, but beyond the pandemic, to intentionally foster that space that many clinicians that you've spoken to have talked about, the need for reflection, and the visual arts is a wonderful avenue and conduit in which to do so. Reflection is so very important for that personal and professional identity formation I keep referring to. And had I had something like this as a trainee, I think it would have made a big difference because it allows you to take that step back and process really what's going on. And that also harkens back to what I said about grace under pressure and grace under fire. How can we move forward and address the recurrent exposure to the pain and struggles of our patients, but also what we're dealing with ourselves if we don't intentionally pause to reflect? And paintings and sculpture and artworks are a wonderful way to do that, in my unbiased opinion. We're also very intentional and interested in the idea of the shared language between museums and medicine, and more broadly, the humanities and medicine. In that way, we try to bridge civic and healthcare landscapes through an interdisciplinary lens of sorts, medical anthropology, art theory, social justice, and of course, clinical medicine. In that regard, we've set ourselves quite a challenge because we want to discuss the artworks that we've chosen in an art historically competent manner, but through a contemporary lens with a medical slant. So it's a lot, and we don't want to be reductive or dilute the matters that we're trying to address. But I always learn something in writing about these pieces with our team. And as someone with no rigorous art background, but an arts enthusiast, I'm hoping that subscribers and clinicians in particular, though we welcome participation from anyone, whether they're in medicine or in the arts or not. So if I'm learning something, I hope that translates to our users and subscribers learning something as well.
Thank you for that. And speaking of, as far as users and subscribers, maybe honing in on a subpopulation of who you hope is impacted by this work, how would you describe the impact or the feedback that you've received so far on residents who have gone through the course, or at least been involved in your other medical humanities efforts?
We have gotten really positive feedback from a variety of demographics within our audiences. My residents have come to a number of the workshops that I used to hold in person at the galleries. That has then translated to them graciously signing up in the very beginning stages of this project in the summer. And what's been really heartening is to see colleagues and peers of mine from both within the institution, but also external institutions. It's opened up a lot of really interesting opportunities and conversations with people from institutions that have very well-established medical humanities departments and programming. And I never would have thought I'd be doing something like this even a year ago, I suppose, but being forced to pivot in a different direction, I think has opened up this really interesting opportunity for me. So with respect specifically to the curriculum, because it is so informal and also user dependent, we encourage adoption of our offerings into self-study models, independent self-study models, as well as small group settings, classroom settings. I've had undergraduate students who are part of our team come back and tell me that with their Women in Medicine undergraduate association, that they've chosen a few pieces from our website to lead discussions with. And that's perfect. That's exactly what we're looking for. I also do a couple of lectures for undergraduate medical humanities fellowship programming, where I've utilized and spoken about the pieces that we write about. And I hope that with our upcoming podcast that we will use as an accompaniment to our essays, that people will be able to engage with that in a different way.
That's wonderful. And I'm glad that you've received this positive feedback. I'm glad that other people have found that moment to, as you said, reflect, pause, and really step back and think about all of these issues, as well as getting introduced to the humanities, dipping their feet into it. Let's see, I think to wrap it up, what piece of advice or some words of wisdom would you like to share with current medical students and trainees, given the work that you've done with them thus far? What's something you feel like they should keep in mind nowadays?
I suppose I would say, don't expect it to look like what you think it will look like. That's obviously from my personal experience. My career is very different now than I thought it would be in the beginning, all the way back to undergrad. I thought I would have a burgeoning academic career as a clinician, and that may not be the case anymore, but there are always other opportunities, doors and windows that will be open to you if you remain open to them. And always put yourself out there, be assertive. Don't be afraid to ask for advice or feedback or help. There will be people who are happy to mentor you along the way, and it will be a wonderful discovery to see where you end up. That's what I would say.
Thank you for those closing remarks. I really do think that openness of being willing to understand that sometimes your journey might change, and that's okay. Sometimes you might, as you've discovered, encounter something that really shapes the way that you see the rest of your life, but in truth provides you the opportunity to really connect with people in a way that's much needed, as you're doing right now. through the RX Museum, through your workshops. So thank you so much for, I would say, in a sense, being that trailblazer in the UPenn community. It's really valuable. And to summarize all of this, thank you for your insights. Thank you for the time, for taking the time to meet with us tonight. This is a wonderful conversation. I wish it lasted longer than 30 minutes, but understandably, people got to go to sleep. So before we go, I want to remind all of you that are viewing right now that this event was brought to you by Ars Medica. We are a nonprofit organization dedicated to nurturing the personal and professional growth of medical students and physicians. Our online community brings together doctors, residents, and medical students to inspire and support each other in our journey toward a meaningful practice of medicine. If you want to join our community or just learn more about us, we encourage you to visit our website, www.ars-medica.org, and don't forget to subscribe to our YouTube channel. Thank you all for tuning in, and until next time.
Thanks, Mari. Bye.
Thank you.